All right, so tooth number 31, lower right, second molar, and we needed to go through the full gold crown. As you can see, that's a gold crown that we went through already with a metal cutter, and that's my endo access. Can they see the endo access? Yeah, that's the endo access, gold crown. We just went through it. Took me about, what, 2 minutes? About 2 minutes to go through the gold crown. All right.
Thank you.
All right, so the estimated working length is 22 millimeters. So let's see, right now I'm hitting the metal, the gold. So I just tilt it so it's not hitting the gold. And I go in until, there you go. Now show the apex locator. All right.
Thank you.
All right, so I pulled out so it's not red anymore. And then I'm gonna mark it here. And mark it here. There you go. Perfect. And then also will measure. Give me the actual
21.
21. So we estimated 22, but it's 21. All right, so now I'm all right. 15 C file, 21 millimeters. All right, so number 15 C file. I'm just brushing the canal walls with it. As you can see, just brushing in and out. It not only instruments but also activates the hypo because it runs at 1000 RPM reciprocating. Excellent. 21 millimeters. Brush away from the danger zone. As you can see, just like that. Use your buckle, 21 millimeters, brush away. Full strength hypo. Side venting irrigation needle. Copious irrigation. Thank you.
Ready?
I want to see if now my flare file goes into the working length. I'm not going to force it. I'm just going to see if it goes to working length. And it does. I'm not even forcing it. So again, I'm brushing the canal walls with it. 5% taper. And brushing with it, I can increase the taper of the canal as much as I want because I'm brushing and removing dentin as much as I can. This is a necrotic case, so I want to make sure that I remove all the contaminated dentin, infected. Right, so let's see, mesio buccal. Almost there. I'm at 20. I don't force it. I'm going to brush with it. All right. That's mesiolingual canal, and still goes to about 20 and a half. I don't force it. Again, I brush with it. Perfect, thank you. With full strength hypo again. So let me have a 20, please. All right. Because my 15 flare file didn't go all the way to working length, now I'm using 20 regular K file with 2% taper, and this goes all the way to my working length. I'm set tab for my night eye file. So that was mesio buccal. That's mesiolingual. As you can see, I'm going to my working length. Again, I'm brushing with it. Full strength hypo in the pulp chamber, and I'm again just brushing. Very good, thank you. So let me have the orifice opener, please. Again, irrigate between each instrument. All right, SX orifice opener by 8 teeth. Very good, pretty open. Just bend it a little bit so I can place it in the mesiolingual canal. All right, very good. Final shavings. That means that it cut. All right, though. Let me have the white. White night eye file by 8 teeth. I'm not going to force it. I'm just going to let it go as far as it wants to go. And brush with it. Let's look at the flutes. Look how how full the flutes are. That's really good. That means that it's cutting really well. Glide path. Okay, so mesiolingual now. Again, I'm not gonna force it. I'm just gonna let it go as far as it wants to go. Again, let's inspect the flutes. Look how full the flutes are. That's really good. Distal now. And distal glides right in. Excellent. All the way to working length. Perfect. All right. Thank you. All right, so let's see. We're done with instrumentation. Microsuction. I'm gonna see if they join. It looks like the mesials join. All right, very cool. All right, here we go, suction. Keep an eye on this.
That's ready.
Sterile paper points to further dry the canals. And I'll do another test just to make sure that the mesials join. Let's see. They join, it looks like almost at the apical like millimeter. So if I pull this one out, now let's see if this one goes in. Yeah, this one goes in a little bit. So they join very close to the millimeter of the canal. Remember the 10 seconds I told you? Suction. Okay. All right. Now again, I'm gonna use paper points, sterile paper points, and I'm gonna coat sealer AH plus on the canal walls, just like that. Mesiobuccal, mesiolingual now. All right, and distal. I don't teach this, so I'm not gonna teach it. Don't do it. This is warm vertical without gutta percha master cone. I can see that gutta percha, mesiobuccal, and I can see gutta percha coming up in the mesiolingual canal, gutta percha and sealer. So they do join the mesials near the apical mill. Okay, hold on to this. All right, 15 seconds. Now I'm going to condense. Condense and hold. All right, thank you. I'm gonna backfill. I just need to add a little bit of sealer in the distal. All right, very good, thank you. All right, I'm gonna backfill the sealer, the distal. Already put sealer in there. Suction. Perfect, thank you. I'm just condensing now the gutta percha. I need a little bit more of those. Thank you. All right, so we're done. It took us about 20 minutes. 20 minutes to do this root canal, lower right second molar, tooth number 31, through the gold crown, and we're done. Let's go ahead and put. All right. Sterile sponge. Cavet. I need more, please. And back to his dentist, just a little bit more. Perfect. For the permanent restoration. The root canal is done. All right. And so we are done. Just like that. This patient was referred to me for consultation and endodontic treatment of tooth number 31. He says he went to another dentist and then was referred to another endodontist and was told the tooth needed to be pulled. So I was surprised to find the tooth tender to percussion, tender to palpation, gold crown, probings 2 to 3 millimeters, periapical relucency. Of course, I was surprised. I said, this is just another root canal, routine root canal. So patient said, I would love to save my tooth. Go ahead and do the root canal. And here it is. So went through the gold crown. This root canal took me about 20 minutes to do. And patient left happily. It was just a pretty straightforward root canal. So anyways, I guess sometimes some endodontists, it's a second molar. They would have to go through a gold crown or what have you. It's all the way in the back, so they don't want to do it. But pretty straightforward. Lateral, bunch of laterals here. So we went from this to this. Bunch of laterals here. Look at that bifurcation in the apical area. Lateral there, lateral there. This is a different angulation. Again, you can see the beautiful lateral here and here. Bifurcation in the apical area of the distal canal. Look at that beautiful lateral there. Another angulation. Again, you can see a nice lateral here. Lateral here, lateral here. Another angulation. You can appreciate the curvature of these canals. Lateral, lateral, lateral. Another angulation. Again, nice lateral here and here, here and here, and bifurcation in the apical area. And look at bunch of tiny little laterals here too.